I now would like to move on to our last panel discussion for the day: frameworks, models, and toolkits that can help
Okay,
advance.
Satish.
Yes.
Before that, we have another keynote presentation by one of our eminent keynote speaker, Mr. Tiago Vacas Felgueira, on telemedicine evolution in health ecosystem. The stage is all yours, Tiago, and all the very best for your keynote.
Thank you, Bridget. Thank you. Good morning for all. So I'm Tiago. I'm head of products from Portugal. I work in AdvanceCare, and let me start to share my screen. So who is AdvanceCare? AdvanceCare started in 1998. It was a joint venture by local insurance and international insurance like Mercury and United Healthcare. And we started because in Portugal, in that time, it was the start of health insurance, the private health insurer. And Mercury and United Healthcare have knowledge about the managed care system. So we create this company to help the local insurance. Meanwhile, we changed our shareholder in 2008. We have only two. One, Tranquilidade is a local insurance in Portugal, and United Healthcare Group, it's a big one, international healthcare insurer. In 2015, we changed again for a global fund, Apollo Management, and today we are part of Generali Group and Europe Assistance. So what is our main assets? We link healthcare providers, insurers, and self-insurance partners, because our institutional clients is not whole insurance, are insurers and public and private self-funded schemes in Portugal, and we link that to their own clients, the final customers. So today we have around 1.3 million final customers, 14 institutional clients. We pay 315 million euros by year, 3.1 million of claims, and we have around in Portugal 50,000 network places, and we manage around 5,000 benefit plans. So this is AdvanceCare. So what we have for our clients, we have the brand. We are a brand with more than 20 years in Portugal. Let me give you, it's important because we don't work only in Portugal, we work in Angola. We started 15 years ago a company in Angola, like us, like AdvanceCare, is AdvanceCare Angola. We work also in Mozambique. We work today with in Europe for Italy and for Hungarians. So we collect a lot of data. It's very important for our clients to can get the correct indicators they can manage their risk. Technological infrastructure, today 98% of the invoice we received is totally electronic. The operational, the provider network, and the clinical expertise. We have around 15 doctors working with us and 25 nurses. So because in health, you cannot work without clinical expertise. So what is the telemedicine evolution? We started the telemedicine in 2017. It was our first approach. In reality, it's not increased. The usage was very low, and the telemedicine was free without co-payments for our clients. But the clients don't shift the physical to telemedicine. What happens is that the COVID-19 was an increase accelerator. And if you see on the graph, in the end of the last year was 65 times more than we have in the beginning of the pandemic. Why? Because with the pandemic, the clients cannot go to a facility. First, because in the first months we have a lockdown, and second one, the clients have afraid to be infected with COVID, so they swift for a new technology, telemedicine. They start to use, they like it, and today our NPS is 84%. And I can say you in this year 2022, where the COVID-19 decreased, what we see is the adoption is still increase. The last month, May, it's because it's also a month with more days than the other ones. We have the most higher volume teleconsultations since the beginning. So, and what we see in here is exactly the same. The adoptions increase a lot, and the frequency, because you can have high numbers of teleconsultation, but you can have more clients in your portfolio. However, the frequency are still increasing. So the clients start to use, they like the use, it's more easy. We have clients who pay and clients not to pay a co-payment for access teleconsultation, and now they are shifting shifting to the physical to teleconsultation, in this case for acute care, and today represents teleconsultations around 20% of the acute care. So what we improve since the beginning to create an ecosystem for teleconsultations in acute care. So first one was online triage. We include a symptom checker, and the symptom checker is the first gatekeeper and the first referral to the clients. With symptom checker, we start not mandatory because we don't want to avoid clients to use teleconsultation. First one, because it's more cheaper than the physical, and for the payers, it's very important. And the second one, we want the clients use teleconsultation for they get habits to use and still increasing the numbers. So online triage is a choice to the clients, but with that, we can first have a correct assessment of the client and make the referral for the correct type of needs. Can be online consultation, doctor at home, a physical visit on acute care, or emergency call for an ambulance to go to acute care. The patient eligibility, because we have 14 institutional clients, we need to know what is the conditions of the clients, if they have access or don't have access, and what will be paid by the client. So we make automatically the eligibility, they pay the copayment if they have copayment. And another thing is very important is the electronic prescription, because you have teleconsultation and you need drugs and for exams, and for that all prescription are electronic. The client receives an SMS with a prescription or an email with a prescription and go to a pharmacy and get their drugs. They can also, if you want, you can also choose don't go to a pharmacy and choose to get their drugs directly in their home. So it's a choice by the client. At least in meanwhile, when clients wait for the teleconsultation, we collect, and I saw the other presentation, the vital signs. It's important because when you go to a physical room, in the first level of triage, the nurse or the doctor collect our vital signs, and today it's possible using our phone. So it's something we get, and give to the doctor for simplify. It's equal the symptom checker. It's to simplify the whole process of triage and have a better consultation with the doctor. So, what is today the scope of the teleconsultation? First, we have a symptom checker. It's not mandatory, but today it's regularly around 7% of the clients use a symptom checker. The second one is onboarding, and onboarding we verify the user eligibility. We give the availability of the doctors, and the client can choose, because something we have on acute care, when you go to a acute care facility, you cannot choose a doctor. It's the first doctor you have is the first doctor you get. So in here, it's very important because we are on online mode. In online mode, it's important the client to see who is the doctor will get the visit, and we give an online profile and a photo of the doctor. We make the schedule. Is make directly by the client. They choose what is the correct time for him. Make the payment if is applicable. And in Portugal, we have 3 ways to make the payment. We have one way is named MBWay, is a local solution. It's very interesting because you only give your phone number. With your phone number, you accept the payment, credit card, and you can pay with a bank referral. The client receives an email, and when they receive an email, we invite the client to make a symptom checker if the client don't make yet a symptom checker, because with that we give that information, that report to the clients, to the doctor, sorry. And we invite the clients to measure their vital signs, to share that information with the doctor for make more easy the consultation. So after you have the consultation, you can choose a video chat or phone. You get the drug prescription if you require drug prescription, and receive another email for filling a satisfaction questionnaire, because it's very important to us to understand how the clients rate the experience with the doctor. So what we see in the numbers. So if you see the frequency increase more than 200% since 2020 to 2021. And what we have on assessments for the symptom checker, we know roughly 75% of the assessments are eligibility for teleconsultation, and very few required emergency care or facilities. For the first call resolution in teleconsultations, we know 70 to 79% of teleconsultation don't require a visit in the next 7 days. It's a very important number, because if you have a lower number if you have a higher number with visits after 7 days after the teleconsultation, something is wrong. So 18%, 79 is a very, very good number. So if we split what happens in the seven days after teleconsultation, because it's very important to know the behavior of the patient after use teleconsultation. What happens? What happens is 6% we use teleconsultation in 7 days by drugs. It's normal. Sometimes we go to the doctor and require using drugs, and 14% have exams. And in exams, what we know is 23% is PCR for testing COVID. It's normal in the next 2 years. So 17% required another type of exams. And when we compare this information with the clients or the patients who go to a facility for acute care, what we have is the same behavior. The difference is the costs. And the costs is more than a double in a physical visit than teleconsultation. So it's important for our payers to make the shift for the teleconsultation. So if you don't have more questions, and if I have time, Bridget, I can show you our platform.
Right. So Tiago, no, unfortunately, we don't have.
Okay.
And I must thank you for sharing your wonderful speech. An honor to have you with us.
Okay. Thank you.
Very much. Over to you, Satish.
Thank you so much, Tiago. I apologize for missing out your session. Definitely was informative.